America members, press, and friends. Welcome to our webinar about our new annual report, the 2016 Parents and the High Cost of Childcare. It's our report's 10th anniversary. We're so excited to share with you our findings and the updates we've made to the report. We hope you find the data and tools useful for your work at the national level, in your states, and communities. Like our previous reports, we find that families and single parents are struggling to afford quality childcare and are looking for solutions. This year's report summarizes the cost and affordability of childcare throughout the United States and provides an overview of the childcare landscape and the strategies that states and communities are using to help parents afford childcare. This year, the report goes a step further and includes county-by-county analysis of childcare costs in the states of Arizona, Massachusetts, Minnesota, and New Hampshire. We are at a critical juncture. We have a new administration, many new congresspeople, interested media, and parent pressure for action. It is our hope, it is my hope as Executive Director at Childcare America, that this report will help shape the conversations that lead to action and solutions for parents seeking affordable, quality childcare. Again, thank you so much for joining us. And now I will turn it over to Dr. Deon Dobbins, Senior Director of Research and the primary author of this year's report.
Thank you so much, Lynette. As Lynette mentioned, I'm Deon Dobbins, Senior Director of Research here at Childcare Aware of America, and my job is to take you through some of the major points of the report. And joining me will be Jess Tersha, who is our research analyst, and she'll be talking about the website, the tools, and our interactive map. And then finally, we'll be joined by Michelle McCready, who is our Chief of Policy, and she will take us through our next steps. What can we do as a community to affect change? So let me tell you a little bit about the report. As in previous years, the report provides rankings of childcare costs and affordability at the state level. And we also, again, compare childcare costs to family expenses that families typically have across the country. New this year, as Lynette mentioned, is a deep dive into some counties in four states. We do a very deep dive county analysis and work very closely with these 4 states. We updated our interactive cost of care map and have some interesting new features that Jess will take us through. I'll share with you some of the solutions from states and communities, and then Michelle will take us through some of the policy recommendations from our organization. So, you know, I know a lot of times when I do these sessions, I have people who are well-versed in the area of child care. You're our friends and our advocates, and you know a lot of what I'll be talking about. But we feel it's important, and we feel that this report is a great opportunity to educate the general public and politicians on the children and families that we serve, their concerns and needs, and the way the public funding systems are set up to serve children. A lot of the child care workforce issues, and why it's important to have quality, accessible, and affordable child care. So in the beginning of the report, we share a lot about the landscape of child care. We share some information about child care deserts, which we had a major report come out in September about child care deserts. And these are places in the country where there is not affordable access to quality child care. And in our report that came out in the fall, we talked to states who are doing some interesting work around that, measuring child care deserts and figuring out where there are problems, where there are access issues, identifying them, understanding what they can do, and creating solutions to make sure that children have access. We talk a lot about that. We also talk about the different demographics that are happening across the country that are affecting the child care landscape. Millennial parents, we know that many of these parents are still struggling with lots of debt, many from college or from schooling, but they're also wanting to be parents, or some of them have decided not to become parents because of the debt they have, and a lot of them are struggling. We always talk about the fact that women are breadwinners now, that many of them are making sure that they're contributing to the budget, the family budget, and some of them are single parents who are solely responsible for bringing home everything as well as taking care of the children. In our Child Care Deserts report this year and in this report, we talk a lot about the need for non-traditional care during hours that aren't traditional. So, you know, we've got people who have shifts and they might need work in the afternoon, they might need child care in the evenings or the late nights, or even people with schedules that are not dependable. So you might work in retail or food and need hours that change from day to day. We talk about the importance of knowing the communities that we're in, the cultural and linguistic diversity that we're facing, immigrants, migrants, and all the different communities that are affecting our child care. We also talk a lot about children with special needs and the fact that a lot of these children are in deserts or are experiencing a desert experience. Their parents have a difficult time finding affordable, accessible child care. And then finally, we talk about children of color and infant care, which is both of those are pretty special areas that we think are important to note in terms of affordability for many of these parents, as well as inaccessible care for them. So we feel that a key message that resonates with the current political environment and most everyone that we talk to is the fact that lack of affordable child care affects everyone. It's everyone's business. So when quality child care is affordable and accessible, the impacts are felt by the workforce, the child care workforce, parents in the workforce, the economy overall, and it's ultimately, we ultimately can see the difference in our children's future when we look at quality child care. So in this slide is one of the infographics that we have on our share kit, as well as a figure in our report. But basically, we know that nationwide families are losing nearly $30 billion each year in wages due to the high cost of child care, and we break out some of those pieces. And we know that businesses lose more than $4 billion every year due to gaps in child care. And of course, we know that our most vulnerable children do better when they are in quality child care. So higher test scores, higher graduation rates, greater likelihood of gainful employment, so forth and so on. The research is pretty clear that quality care is really important for our children. And then finally, we know that affordable care is a workforce support. So parents are best able to work when they feel confident that their children have affordable care. So let me tell you a little bit about how we get our data. So we get them from our members, child care resource and referral agencies, and government agencies who collect child care data at the state level. So we have data contacts around the country that we work with to collect this data through a survey. But then there's a lot of back and forth individual follow-up with our data contacts to ensure that our data is clean. We collect data on costs for infants, 4-year-olds, and school-age care. And this year, we expanded our school-age care numbers to include those children who are in care for 3 months, so the summer months, for 9 months, which is the school year, or for 12 months year-round. We also look at center-based care as well as family child care. And we then pull data from a number of national databases, including the Census and the Bureau of Labor Statistics. And this year, we also looked at county-level costs with the 4 states. We requested their data and worked very closely with them to analyze that data and come up with some context around the data that we had. The survey goes out at the beginning of each year asking for cost data, and for the most part it comes from either market rate surveys or data that states have in their database around cost. I'd like to really give a special shout out to the state leads who worked with us to clean and verify all the data throughout the country. It is a several-month project, and especially to those who worked with us on the county level data in Minnesota, New Hampshire, Massachusetts, and Arizona. It was a lot of work, and they gave us great feedback on our data. So here are a couple of the key findings. First of all, I'd like to say that we calculated affordability by dividing the average cost of care by the state median income. So that I know sometimes we give numbers and actual dollar figures, but expensive or the higher the cost does not necessarily mean that it is least affordable. We really do want to take into account how much people are making in the state and sort of their cost of living. And the basis for our map that you'll see a little bit later is center-based infant care in 2015 as a percentage of the state median income for a married couple with one child in child care. That's a mouthful, but if you can't remember what it is, we do describe it on the map and in the paper. So this year, the U.S. Department of Health and Human Services recently announced a new standard of affordability for child care fees. It used to be that they did not want any parent to pay more than 10% of their family income, and now it is less to 7% of the family income or less. So if you look at the chart here, you'll see that one of the key findings is that by this new benchmark, we found that 49 states are affordable, and even the one state that we considered quote-unquote unaffordable just fell under the 7% criteria. So really, all the states are unaffordable, and that one state was Louisiana, and we'll share a little bit about that later. And that's for the center-based care, infant care. If you look at, we also were really wanting to dig deeper into family child care this year. We always had the tables and the appendices in the back around family child care, but we wanted to really bring that out in the report this year. So if you look at family child care, by our standards for 7%, there are 45 states where infant care, plus DC, where infant care is unaffordable. One note about our appendices in the charts versus the appendices, the charts in the appendices versus the charts in the report. So in our, when we were collecting data and ranking states, the state of Colorado and the state of DC are not in our rankings in the report. We didn't include Colorado per their request because they collect data differently and weren't sure that it would really be comparable, and they do it by region instead of across the state. They didn't want their data to be compared. And then DC, as a capital city, is not a state, and it's a special case. It's a city with lots of variability around their costs, very high income and very low income. So in the report, we do not, in our rankings, do not include DC and Colorado. When you look at the appendices, however, we wanted to show all the states and the capital, so you'll see that they're in there. So we've had people say, when you look at the report, it looks like my state is number 5, but when we look at the appendices, it's number 7. That's why, because you'll see that DC and Colorado are included in the appendices. So let me go to the next slide, please. Another thing that I think is consistent with previous years is that we see that single parents are struggling to pay child care. It's even more affordable for them, especially for infants. So in every state, the average cost of center-based infant care exceeds 24% of the median income for single parents. And this chart shows the most affordable and unaffordable states for single parents interested in center-based infant care. So on the top, for center-based, the most affordable is South Dakota, and the least affordable was Massachusetts, taking 24% and 61% of their state median income respectively. And then on the bottom, we're looking at family child care. Some of the with 2 children, I'm sorry. On the bottom, it's looking at 2 children in center-based care, not family-based. We also wanted to show where DC falls, and as you can see, it is really, the data for DC is staggering as usual. It would take 161% of a single parent's income to pay for center-based care for 2 children in DC. You can turn the page. This is another key talking point that we've shared in the past and very similar this year. In general, you know, the cost of care itself, if you look at the charts where we show the cost of care from year to year, not increasing exponentially. But if you look at a family and their individual budgets, it's often exceeding the cost of housing, college tuition, and transportation and food. It's one of the most major expenses in a family budget, and except for in a couple of places in the West and in the South, the only thing that is a higher expense, and not by much, is housing. This is another one that I think the media catches on to a lot. It's something that we've seen over and over again, and infant care is really very unaffordable. And it's nice to see the way that we're being able to compare it to things that people are very familiar with. So center-based infant care is more expensive than 1 year of college tuition at a 4-year public university in 30 states plus DC, and center-based care for 2 children is more expensive than a median mortgage in 35 states plus DC. So those are pieces that are easily understood by many people, and it shows just how expensive it is for especially infants. And then finally, we really are interested in the child care workforce. We know that, you know, our child care workforce, whether we call them teachers or providers, are often the first teachers for our children. We also know that when they're qualified and when they are, they have the professional development that they need, their salaries will increase. But we know in general that child care providers aren't making enough money. They are one of the least paid professions, and that the salary of child care workers really helps subsidize the care for many of our children because they aren't making enough money. And we find every year, we look at this statistic either, that most aren't making enough to afford child care for their very own children. So in every state, we are seeing that a child care worker with 2 children would pay more than half of their income toward child care. Something that we're really interested in making sure that you know, child care is labor intensive, so it should be costly, it should be quality though. And we need support from both the federal level and the state level to help workers have a livable wage, but also to ensure that the costs aren't passed on to parents. So our cost of care map was one of the features that many visitors enjoyed looking at last year and liked. We did get some feedback from folks so that they would like to see some updates. And we're pleased to let you know that we updated it this year, and there are some very user-friendly features that we wanted to highlight. I'm going to turn the phone over to Jess, who will take us through some of the features and the functionality for the map.
Thanks, Dion. We were very excited to unveil our new cost of care map last week, and hopefully you've gotten a chance to play with it a little bit. If not, I'm going to encourage you to check that out after today's webinar. So just a quick rundown of some of the new features to this year's map. You might have noticed we've changed up the color palette to more clearly show the differences between each of the states and the percent median income that folks there would have to pay for child care. As Dion mentioned, there is a new HHS standard saying that child care cost is really unaffordable if it's over 7% of median household income. So we had to add an additional color. And one of the other things that we've added this year is a few pop-outs and pull-up menus so that you can get a better look at some of the data for each of the states. Here are examples of some of those pop-up windows. So you'll see a new pop-up window for each of the states showing the cost of child care for center-based and family child care in each state, as well as the percent of income families are having to pay for child care in each state. In addition, we've also added some print-friendly PDFs so that you'll be better able to take that information with you when you leave our website. In addition, we've also added county-level mapping for the 4 states that we featured in our report. Those states include Arizona, Massachusetts, Minnesota, and New Hampshire. And we also have data pop-ups for each county in those 4 states. So I'm just going to switch screens for just a sec, and we're going to do a brief walkthrough of the map. So what we're looking at now is this year's revised page where we've got the map front and center. You can see that as you hover over the state to make your selection, you'll be able to see which state you're choosing. So if we start with Minnesota, if you click once, you'll get that nice, clean little pop-up window showing the annual cost of child care in Minnesota. Again, this is center-based infant care, as well as where they fall on our spectrum of the percent median income. So once you get that pop-up window, click on View All Data, and you'll get that nice pop-up of a deeper look at the information for Minnesota. Once again, just like we saw in our webinar, you'll be able to see the cost of child care as well as the percent of income for that state. It's pretty easy to navigate between states now. You can either X out of this window, and we'll go back to Minnesota, or you can choose another state through the Select State menu in the upper right-hand corner. So we can very easily check out another state that way as well. So we're going to navigate back to Minnesota here. And once we scroll down and look at the bottom of this page, we'll see an option to download this data. And when we click on that button, what pops up is a printer-friendly PDF fact sheet for that same data for Minnesota. So we've limited the color on this page so that it doesn't kill anyone's ink on their printer, and it will be a nice, easy way for you to take this information with you. So we'll navigate back to that map. As I mentioned, we have county-level data for 4 of the states. Minnesota is one of them, so let's navigate back to Minnesota, and we're going to double-click on Minnesota to get that county-level mapping of the data there. And from here, the mapping functions very much like the nationwide map. We can hover to see which counties we're looking at. And once we choose our county and click once, we'll see our little snapshot for this county, St. Louis County, with the cost data and where they fit on our median income ranking. And then we can click on View All Data to see that same pop-out window for the county that we selected. And again, you'll be able to navigate from county to county pretty easily and X out of that to go back to looking at Minnesota. To get back to the map, you can simply click on the button to the right and go back and select your next state that way as well. Some other features that I'd like to point out is you now have to scroll down a little bit further to get to the report and the appendices. We've made them separate documents on our website this year because we added a substantial amount of information to them. If you've reviewed these documents, I'm sure you'll see that there's quite a bit more information in there. This is also where you'll access the National Social Media Toolkit, as well as a new feature this year is our parent tip sheet. We wanted to include some suggestions for parents who are looking for affordable or accessible childcare in their area and are hoping that this will provide some solutions for parents. In addition, we have this year's one-page infographic, as well as some social media toolkits for each of the states that we featured. So those are personalized to each of those states. We also have created a link so that all of the other states out there will also be able to customize their own infographic. And you'll access those customizable infographics for your state by clicking on Get Started. So that's just a quick overview of the map. And I'm going to hand the mic back to Dion so she can talk a little bit more about the cost of quality care.
Thanks, Jess. I really think that these tools are great. One one of the things that we wanted to highlight was the state of Louisiana. It kind of sticks out on this map. It's the only one that's a different color. It's gold. And as we mentioned, and we mentioned in the report, Louisiana is the only state that falls below HHS affordability standard of 7%. Now, it's 6.7, I believe, so it's barely falling under the affordability standard. So we want to make sure that we make an important note about Louisiana, and that is that low cost or low affordability does not equate to quality child care necessarily. So, you know, we look back at our, when you look back at our licensing reports that we've done over the past, the latest one is 2013, and we are currently working to update that work now. But in 2013, Louisiana's center-based care scored in the bottom 5, and it was dead last for family child care. Family child care in general in the United States, in that report that we've done, is characterized typically by weak state inspection standards, incomplete background checks, weak training requirements, weak early learning standards, and weak basic health and safety standards. And we'll be updating that to see if that stands. But, you know, we don't want people to think that just because a state is affordable that we're necessarily saying that it is quality. And then, you know, although we know that Louisiana is doing some great things, and we actually highlighted the school readiness tax credits, we also know that that's only one piece of the puzzle, and tax credits alone aren't enough to support the tens of thousands of children in the state that need quality care in the state. And so while we think that we're really, we think that the tax credits are a great model, we also want to acknowledge that they're only one piece, and that just because we say something is affordable, we're not necessarily saying that it's affordable at all quality levels, because that's something that we did not look at for this report. All right, so now I wanted to take you into the four state county analyses that we did. I'm not going to spend a lot of time on all of them. Wanted to give you a sense of what we did and how we did it, but share an example from one of the states, and that would be Minnesota. We worked with our National Data Systems team, also known as NACRA DataWare, to work in 4 states where we had relationships, good relationships with the CCR&R there, or the folks that handled the data, where we knew that they would allow us to work with their data from NACRA DataWare. And also we were on a very short time frame, and so we knew that they agreed that they would be able to work with us on this truncated timeline. And we really wanted to understand what's happening at the state level. A lot of times when we are working in a state and we see that a state has a high cost of care, it doesn't really help us necessarily understand the comprehensive nature and the context that's happening in that state. So the cost of care, if you're in a state, you know this, can vary from county to county within a state. And it can significantly vary from statewide averages. There could be one county that kind of pushes you up and others that are lower. And we know that just in general, that child care is often more expensive in urban settings than in rural parts of the state. And sometimes that means the statewide average can underestimate the cost of care in the more heavily populated regions and underestimate the cost of care in the rural regions. So in addition, cost of care can vary considerably based on the landscape with regard to whether or not you've got primarily family child care or center-based child care. And because in general, again, the cost can differ greatly between the different types of programs. So I'm going to just highlight one example or one thing that we found from each. I want you to go back and read the report for more of the specifics, but then I do want to highlight some things that are happening in Minnesota. So when we looked at Massachusetts, which is, if you recall, was one of the least affordable states, particularly when we were looking at infant care, and when we looked closely at the county level for that, No county in Massachusetts was at or below 7% of the median family income in order to pay for child care. When we looked at Arizona, one of the things that we found was that most of the providers, family child care and center-based, are located in one county, and that's Maricopa County, and that's Phoenix. So one of the things that we wanted to be able to do later, we'd love to follow up with the state to look at the child care deserts issue and think about like where the quality centers are, where costs are being most impacted. But that was something that came up. A lot of times when we did this work, it gave us more questions. In New Hampshire, we found that there were wide variations in the cost. And for example, in family child care, we saw that it was most, for the 4 states that we looked at, it was most consistently priced in New Hampshire, with costs ranging from 8.3 to 11.8%. And then finally, Minnesota. If we can turn the page. Sure. So one of the things that we talked about is Minnesota, if you look back at our report, is the 5th least affordable state for a married couple seeking infant care for center-based infant care. But the interesting thing is when you rank it by family child care, the affordability drops to 40th for unaffordability. So in the past, one of the talking points, you know, if you looked at the state of Minnesota in our past reports, a lot of times they were very high in unaffordability. We were looking at center-based care for infants. The people that our colleagues in Minnesota were like, please also think about what's happening with family child care. And the reason why they wanted us to do that is they rely very heavily on family child care across the state. So here's the thing. About 73% of the center-based providers are in 8 counties, and they're located in urban areas like the Twin City area. So that's swaying the cost if we're only looking at center-based care. But if we look at the cost of care for family-based, it's much more affordable, though still costly, but you'll see a difference in affordability. So in this case, it was very interesting because we were able to show that affordability was driven by the high cost in urban corridors where the incomes are simultaneously lower, and low number of center-based child care programs in rural areas, and they weren't able to balance the higher costs that were reported in urban areas. One of the things that was great about working with Minnesota is after we showed this data, they were like, this totally makes sense because we've just, there's a report that came out by the Center for Rural Policy and Development in Minnesota called The Quiet Crisis. And what they found was that researchers described the unique concerns that were faced by families and employers statewide. That basically, not only did they find this kind of work, but they found that there was a diminishing supply of child care slots. So while almost 260,000 children ages 0 to 5 have parents in the workforce that are likely to need child care, the licensed child care programs in Minnesota have the capacity to reach less than 225,000 families. So there's a capacity gap, and that's an estimate of at least 35,000 centers. And although the numbers show small increases for the center slots, they're also seeing some declines in family child care slots across the state. And so this is not unique to Minnesota, but families are relying on family child care in very rural states like Minnesota. It's a business model that has worked. And when families don't have access to child care, their employers are facing shortages with staffing. Parents cannot send their children to child care and they can't go to work. So one of the things that was really interesting about this report is they talk about the fact that child care shortages have a ripple effect on the economy. And that's why we think it's really important to look at a state through, the county level piece and to see the comprehensive nature of the different types of settings that children are placed and the cost by setting. We'd love to, again, look closely at quality in the coming years and really look at cost, supply and demand, and quality at the county level to really have a comprehensive picture of what is happening in these states. So then finally, Michelle is going to talk in a few minutes about our policy recommendations at the federal level, but there are just so many things happening at the state and local level that we pull out in the, that we highlight in the report. And just talk a few minutes about some of our proposed solutions or some of the highlights that we found across the state. First, we know that child care settings, like any other business or nonprofit, need to take into account their revenues, their expenses, the regulations that must be met, standards, quality improvement, and they need to strengthen, we need to think of child care as a business, part of the business sector, and we need estimates of what it costs to have those pieces of a quality child care. So one of the things that we really want to point to and highlight and really hope that states will have a chance to do is look at tools like the cost of quality tools that are available on the Office of Child Care site that talk about the ways that you can measure cost as it relates to quality. And so, for example, we know that if you have better staff-to-child ratios, teachers are able to give more individualized attention, but that's going to cost more. We also are very interested in when states have been able to build the supply of quality child care settings. Some parents, we know, prefer settings where they're in a family child care settings. And so what some states are doing is coming up with what they're calling family child care networks. One that we always talk about at Child Care Aware of America that we think is doing incredible work is All Our Kin in Connecticut. They do a lot of training and technical assistance, helping child care providers think of themselves as businesses and helping them become licensed and improve their quality work with children. And they've got some great research behind their work. We are really interested in understanding when businesses are helping to support better child care. We've got a whole section in our report about where businesses are stepping up to the plate to either provide child care subsidies or supports for parents, as well as other things that are kind of related to child care, like the parental leave. I've got some examples of states that are doing some great work with taxes and fees for services or commodities that then help the child care system. We did talk about the credits in Louisiana, and you'll be able to see that. And then there's other communities and states that are assisting families by increasing the pool or the pot of money that could go for child care state assistance through some creative financing. I won't go through all those specifically, but I want to point those out. Take some time to read through the report so you can get some specifics about that. And now, I believe I will be turning it over to Michelle McCready, our Chief of Policy.
Thank you so much, Dion and Jess, and hats off to both of you for leading a wonderful and tremendous report, and all of you across the country for your hard and tireless work and getting us the data. This report really wouldn't be possible without you all. So thanks for joining us now, and thank you so much for helping make the report what it is today. I just wanted to put an exclamation point behind a couple of things that Dion and Jess shared with you. Although there are some wonderful bright spots and hard work done by government to fix the child care challenges, by business communities, by personal employers, by communities, there is not enough. We know that millions of parents, quality, affordable child care is simply out of reach for many parents across this country. We see these astronomical costs that are very high against median income in every single state, and that parents are really struggling. And so we at Child Care Aware of America are encouraging you to, yes, use these tools, use this data, use this report to move the needle, to customize these resources to make the story and the case in your state and at the national level on why quality child care matters, why it's unaffordable, and what I'm talking about right now, what we can do about it. So we have a couple of national policy recommendations and are always looking to work with communities to expand these and to support all the incredible amount of advocacy work that you all are doing at in your own states and communities. The first one is to expand the funding and increase the funding for the Child Care and Development Block Grant. In 2014, there was a reauthorization of this particular block grant that set a whole new host of parameters and requirements around health and safety and training for the child care community in every state. That requires funds, that requires support, and we need to be making a strong case for both expansion of that funding to states and also increasing the amount of access for parents to receive the subsidies, to receive assistance, to go to and afford quality child care. We know that it's woefully underfunded right now. Only 1 out of 6 families that are eligible to be receiving CCDBG are actually getting it, and that's for a whole host of reasons. Sometimes it's not having enough funding. Sometimes there's other barriers and red tape for families. And we want to work together on solutions to ensure that all families have access to quality, affordable child care. Another policy recommendation in the report is to limit the cost burdens for families. We talked a little bit about ways to do that, raising the dependent care limits for deductions, additional refundable tax credits for families and providers, encouraging things like public-private partnerships between the business community and the public dollars that are passed through to child care. Other programs like Early Head Start Child Care Partnerships have been a great pilot program in helping increase access, accessible, affordable child care for communities. But so much more has to be done. These are just steps that are helpful, but not the entire part of the equation. Other steps are streamlining eligibility standards and procedures. We saw within the new reauthorization law that the 12-month eligibility requirement is very helpful for families that so they don't need to reapply continuously throughout the year. However, there are still ways to streamline the eligibility, the procedures, the process that families have to undergo to be eligible for subsidies. Another area of great challenge in a community of people that have exceptional amount of challenge with finding and affording quality child care are students. I think this is a surprising statistic to many that 1 out of 4 students are actually parents. And child care breakdowns are such a significant part of why students drop out of school, why they don't pursue higher education in the first place. And it's really a loss for not only the communities that the particular student, but businesses and the economy. And then Dion mentioned a lot about ways that we are thinking about prioritizing professional development for the workforce. And I can't emphasize this more. You'll see in this picture on your screen this interaction taking place between the child care provider and the child care attendee, this wonderful little girl. And that is such a critically important part of the quality of the child care, of the foundation of the child's life and brain development, that we want to make sure and we advocate for strongly that those child care providers are well supported in their professional development path and also well compensated and compensated adequately. So that's part of our fight. I am going to show you how to get involved now with Child Care Aware of America, and if you want to work with us to continue the fight for quality, affordable child care. You could visit us at childcareworksorg. We have a network of parent advocates and family advocates, and that you don't necessarily even need to be a parent going through child care challenges. We have aunts and uncles in our network. We have grandparents and all types of community members, child care providers, teachers, child care resource and referral agencies that really have signed on, have joined us at the movement by the tens of thousands in the last couple of months. So thank you to all of you who have taken action to send letters, to talk with their policymakers who have really shared their personal story around why quality child care is so critical to them. As you know, and as a working parent, I have 2 children in child care right now, today, And I have incredible child care providers and it's wonderful to be able to go to work and have peace of mind that my children are not only in wonderful hands, but they're learning, that they're developing, and they're very well cared for. So my 3-year-old Aiden and my 1-year-old Lily are in this wonderful environment. And that's really what we want to see for all children. And to ensure that, we know that it's unaffordable on both ends, so that the child care providers are, as Dion mentioned, are at times subsidizing the quality child care that the children are getting and subsidizing the cost burden for the parents, even though it may not seem like that, especially for parents that have young ones, infants and toddlers in child care. It can be, as we tell pretty detailed in our report, a significant amount of their paycheck. And so what we want to do is find solutions that ensure all boats are rising, that quality, affordable child care is not just out of reach for parents, but that child care providers that are doing this incredible amount of work and are an incredible piece of the economy are very well supported. So again, join us at childcareworks.org and get involved.
Great. Thanks, Michelle. We do have a couple of questions, and we'll look and see that came through as we were talking, and I'm going to have Jeff look through to see if there are any others. If you have some questions, this is the time to ask them. But one of the questions was, will we be able to access the webinar after the presentation? And the answer is absolutely. We hope to be able to post slides by the end of this week with the webinar recording. We also, someone asked if the 7% median income is a benchmark. It is. It's, let me reiterate, it's the recommendation from the Department of Health and Human Services. As I mentioned earlier, the recommendation has always been 10% of the family's income, and this year the recommendation changed to 7% of a family's income. If there are any other questions, feel free to type them in to the little question box.
While you all are typing, I just wanted to make one other note. Although we did look at 4 counties, we are laser focused on expanding our county level work. As most of you know, a median income in each state can only share so much about the state. And so having that county level, the community level perspective gives more insight into what's actually happening. And giving, you know, those that level of data helps with your own advocacy efforts to talk about what's actually happening in your backyard compared to just a median or state average. Yep, and I just wanted to also show up on the screen. This is a clip from our Child Care Works webpage. This is how you can take action. We are encouraging everyone to write in, share your story. We'll be sharing them with the Hill, and we're happy to answer any questions in your own advocacy strategy. So another question that we got was, how can providers make their voices heard? Love the question. Thank you for it. This is not just a movement for parents. Child care providers, as I talked about a little bit earlier, are a critical element in the supply of quality child care, and we want to make sure that that's well known. And so we have a place just for, you can look at our 3 priorities on our Child Care Works page. We have a place and a space, and would love to hear the providers to share their story so we can mobilize and activate that community as well to raise awareness about the critical work that child care workers do.
We have another question, and someone is asking about the state of Texas and why there are no county information for the state of Texas. As I mentioned earlier, this was sort of a pilot for us. We worked with 4 states this year, I mean, our ultimate goal would be to have that rich level of data for every state, and hopefully we can do more next year. It really is a resource issue, and we are going to be doing some in-depth work with another 13 states where we'll be looking at cost as well as a couple of other things. So keep looking at our website and coming and checking out our map, because we will be adding new information as we can.
Great. And so we have a couple of questions about how to help parents and also how to help providers. And so I'll start with the parents. So we actually, I have 3 recommendations if you're a parent on the phone, or if you know somebody who is or becoming one very soon looking for childcare. The first is to start early. We can't emphasize this more, especially in areas, I know like Northern Virginia and DC and a lot of urban areas, but also rural areas at times have wait lists. So starting early will help parents find the setting that's right for them, whether that's a family child care home or center-based care. It's really great to get an idea and not have to rush at the end, but really have some options available to you and find the choice that's right. The second is call the expert. And we have a huge network of child care resource and referral agencies across the nation that are at the ready to help parents find and afford quality child care. And you can find your local expert if you visit childcareaware.org. It will take a search engine and a phone number where you can call and be connected. They'll also help you with tips on what to ask when you're at a child care facility. That same email or that same web address is also a place where child care providers can get resources and opportunities and ask questions about how their business is operating, for example, or any resources available for them, like small business loans and that type of thing. So we can't encourage you more. I gave a lot of websites today, but if you're a parent or a provider looking for more resources, visit childcareaware.org. Here at Child Care Aware America, it asks about, one of the questions is about who we work with and how on our advocacy strategy. We have several different coalition partners across the nation. A lot at the national level are on coalitions, including unions like SEIU and AFSCME and others that care about issues that affect and impact working families. So we're part of a variety of coalitions and will continue to be.
And someone asked if when we're collecting data, do we ask whether providers pay for snacks and diapers? That is a great question. And we are collecting data at the statewide level, and I'm not sure if we have that level of data by provider. We do have a couple of data points about whether the number of, I think the number of providers that are taking part in the different food programs, and that's I think on our state fact sheets for this year.
Yeah.
But yeah, we don't ask about diapers. That's interesting.
Yeah, we don't specifically call that out. However, when providers are providing snacks and diapers as part of their program, they typically do include that in their operating costs, so the total cost of their program. However, like Dion said, that may be something thank you for the recommendation, and will be something we definitely want to explore what that costs in addition to the price of child care.
Yeah, we have some questions from specific states, and what we might be able to do is look at your specific questions and reach back to you, because you know every state is different. But there was a specific question from Texas about their complicated system for reimbursement. So we would need to probably have a follow-up conversation with you about that.
Yeah, absolutely. And just back to the policy recommendations. Texas, you are not alone in complicated systems on child care reimbursement for both the provider and the parents at times. And one of our policy recommendations is to really ensure that that's streamlined. So it's not a disincentive for either providers to enter into the subsidy system or for, or to dissuade parents from accessing the services that they're eligible for. So that's a great point, and we'll love to follow up with you.
If you we don't have a slide with our names on them, but Michelle McCready is our Chief of Policy, and her address is michelle.mccready@usa.childcareaware.org. And I'm Dion Dobbin, and it's the same pattern, Dion, D-I-O-N-N-E, Dobbins, D-O-B-B-I-N-S, @usa.childcareaware.org. So some of these questions, if you want to follow up with us after, we're happy to work through them with you. Also, on our website, I think there's a contact us button, and that we'll get the questions from you on that.
You guys have been terrific. Thank you so much for carving out time and joining us today. We hope to see you on our website, and hope these tools are helpful. Thank you so much.
Thank you.
Take care.